Okay, so in recommendation 9, we talk about the issue of patients who are on high doses, that is higher than the currently recommended doses, or frequently higher than the old watchful dose from the 2010 guideline, which you'll recall was 200 milligrams per day morphine equivalents. And the idea that if you have patients on these higher doses, you should have a discussion with them about tapering down with potentially the aim of getting to the current target doses. Now, we recognize that for some patients is a very ambitious target. We also recognize that there are some patients who simply do not seem to be able to taper down. The idea with the tapering is that by reducing the dose, you'll move the patient from a higher risk group into a lower risk group, but that kind of data is not entirely clear. One of the other bits of rationale behind that is that there's a concept of something called opioid-induced hyperalgesia, which may present in some patients where increasing the opioid dose actually increases their sensitivity to pain. And by reducing the dose, you return them to a more normal sensory function. Now, the fact is that as we try to do that, some patients are able, with considerable support, to tolerate the tapering down. Some patients do not seem to be able to do that, and they experience significant loss of function, perhaps being unable to go to work or carry out activities of daily living, and they experience a marked deterioration in their quality of life. And in those patients, after discussion about the risks and benefits of tapering versus staying at the same dose, you may find that the taper has to be abandoned, and you simply maintain that patient, continue to support them, draw their attention to the potential risks and benefits, be alert to the appearance of new problems like sleep apnea and things like that may drive you more strongly towards a dose reduction. But this is one of the most challenging recommendations, and it's probably one of the ones that seems to have created the most difficulty because it doesn't seem to have been interpreted with any sort of judgment. It's occasionally applied I think too much across the board when it really needs to be applied with some judgment and recognizing that some patients are going to continue to present challenges